Yes, well, good afternoon, everyone, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Middle Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan. And I want to thank you all for attending this afternoon. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your region, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raised hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is the comment bubble icon. Our team member, Jaquita, will be monitoring the hand raises and chat box during the entire workshop. If you're on the phone calling in, you will be unable to raise your hand or use the chat box. So during the discussion segments, we ask if anyone on the phone would like to speak, please unmute your phone and begin speaking. A little bit about the RHST team. The 2050 RHST plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the Middle Georgia region. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs, and then Kirsten Moat from Modern Mobility Partners will guide the discussion session. We will also have a couple of question and discussion points throughout the workshop. So what exactly is rural and human service transportation? Not many people may be familiar with these terms. Rural and Human Service Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to do a general update of the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from that first plan to identify projects, programs, and policies to meet current and future demands and provide enhancements to RHST across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation across the state. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency's system operates independently, using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to that plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The RHST Plan 2.0 outlined coordination activities among the rural public and human services transportation providers across the state to achieve improved service delivery for the state's public transit and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2001, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we've wrapped up our vision and goals, which I will discuss on the next slide, and are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with a pink circle indicate the technical advisory group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from the regional commissions, the Statewide Independent Living Council of Georgia, and other stakeholders identified during our stakeholder engagement process. We are engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. We are also conducting a statewide survey for RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to access the status of the RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited during the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan, which was updated in 2020. Our vision statement outlines where we'd like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer to walk us through the available transit in the Middle Georgia region. Will?
Great. Yeah. Thank you, Matt. And good afternoon, everyone. So glad you could join us. As Matt mentioned, my name is Will Brewer. I'm a transportation planner with the AECOM team. And I'm just going to take us through a couple slides of the existing transit systems and service areas within your region. And we can zoom into your region right now. So Middle Georgia, just a few things I want to acknowledge right off the bat. There is the presence of Macon-Bibb County Transit Authority with 10 fixed routes and paratransit, as you can see there in the middle. And then you have several rural transit systems, Baldwin County, Crawford County, Peach County, Putnam County, Wilkinson County, Pulaski County, Twiggs County, all demand response rural transit systems. In those areas that you can see there on the first map in white, Houston and Monroe, those are 2 counties without any public transit. The next 2 visualizations maps I'm going to discuss will be Department of Human Services and DCH non-medical trips. So with DCH, there's pretty wide coverage there with the, DHS. We have a Division of Aging, Division of Family and Children Services, and Department of Behavioral Health and Developmental Disabilities. These are 3 parties that are involved with the DHS services in this region. And finally, those non-emergency medical trips for medical treatment, medical evaluations, obtaining prescription drugs, dialysis centers, and so forth. There are 2 brokers that operate across the state in 5 different regions. Your region happens to cross between 2 regions, and they are both provided by MotiveCare broker. So just, general snapshot of the existing systems and service areas that you have in your region. And so we're going to revisit these maps and make sure that we have all the correct information moving forward. So I'm going to pass it over to Kirsten so we can talk a little bit more about this.
So thanks, Will. So this is kind of our first pause, and we want to get your feedback on what we've presented so far and answer any questions that you may have. So as a reminder, if you're joining us by computer or smartphone through the Teams link, you can use the raise hand feature and we will call on you and you can speak. Alternatively, you can use the chat box function. I've got a couple polling questions to kind of get us started. So up on the screen, if you can see it, we have a QR code that you can use. You can also join us by computer or smartphone by going to www.menti.com. That's MENTI, menti.com. When you arrive on that screen, it's going to prompt you for an 8-digit code. The code is on the screen. I'm also going to call it out. It is 25826787. And that's 25826787. So the code will remain at the top of the screen. The first question that we want to ask is we really want to ensure that we're getting the existing transit system accurate. So in the 3 maps that we'll walk through, and I'm going to go back to them and talk about them a little bit more, we want to make sure that that information is accurate. We also want to understand if there are other transportation providers in your region that don't fall under these categories. So maybe there's a local nonprofit like a church or a nonprofit organization that provides transportation services independently. And they do it for a specific service or a specific group of people. Those are the types of transportation services that we may be missing. We want to ensure that we have that. So on your phone and your computer, you should be able to enter your responses. If you're calling in by phone or you have not accessed the Mentimeter or the menti.com polling, you may unmute yourself and feel free to speak up. So I'm going to go back to the maps. So again, as Will mentioned, on the public transit side, the Middle Georgia region is fairly well covered. There are 2 counties, Monroe and Houston, that do not have transit service. Bibb-Macon Transit Authority provides services in Bibb County. And then the rest of the counties, Putnam, Jones, Baldwin, Twiggs, Wilkinson, Pulaski, Peach, and Crawford all have on-demand rural services. We also indicate that DHS has a full coverage area for all 3 services that they provide: Aging, Department of Family and Children Services, and Department of Behavioral Health and Developmental Disabilities. The non-emergency medical is also fully covered in this region, but it's across 2 broker regions, the Central region and the Southwest region. Both of those regions are brokered by MotiveCare. Back, see if we have. All right, we're not sure if there are any missing. Well, that's headed in the right direction. We hope that we're reflecting the transportation correctly. I think as most are aware that rural and human services transportation can get very complicated and very complex. But as a basis, we want to make sure that we're demonstrating where service is provided. So I'm going to move on to the next question. Again, if you think of something, feel free to raise your hand, or you can enter it on the next polling question. So thinking about the existing services that exist, the existing services in Middle Georgia region, what are some of the constraints that you are experiencing with providing rural and human services transportation? Perhaps this is not being able to provide service on all the days that you would like to, or maybe you can't provide it during some of the hours that you would like to, or maybe your constraint is funding. I think that's a pretty standard constraint. Um, constraints on labor force. Maybe you're experiencing driver shortages, mechanic shortages. Maybe your constraint is that you just have demand and you can't meet it because you don't have enough vehicles. So those are some of the constraints. So we've got a couple responses. So the first one is people working night shift cannot rely on demand response services or on weekends. The very valid point, especially in areas where you have manufacturing, warehousing, and distribution that run 24 hours, and you do have those third shift employees that are working overnight that don't have access to transit. It makes it very difficult for those employers to find appropriate labor pools or access those labor pools. So I think that's a great comment. Next one, answering system for 24/7 calls. So I'm going to assume, and whoever put that in there, please feel free to chime in. This is a lack of an answering system for 24/7 calls. Lack of. Okay. Thank you, Lindsay. Yeah, I think that's good. So you're getting calls 24 hours a day. People are not there to answer them. And so perhaps ride requests are getting missed. And perhaps riders, because they cannot call during the times that are available to them, may give up and may not try during other times of the day. So we got a second one for that, answering service for 24/7 calls. Chiquita, do you mind reading that comment?
Sure. Let me pull it back up. Hold on, in the chat box. She says, and this is Lindsay, I was meaning more like when people are calling in and it could have some sort of automated message with information that they need. And then, okay, so yeah, that's what she's saying. I was meaning
Okay.
more like when people are calling in and it could have some sort of automated message that gives information that people need.
Okay, that's a great one. I haven't heard that one yet in our workshop, so that's a new one, and I think a really great suggestion. We have a couple others. Transit providers do not go outside of their county boundaries. We've heard this a lot with these providers and the inability to cross jurisdictional lines. So we're gonna talk a little bit more about that, but that is definitely a constraint that comes up over and over again, and has been coming up for a decade since the last plan in 2011. And we don't run on weekends. So again, getting back to being able to provide the service when people need the service, people still need transportation on weekends, and due to funding or due to labor or due to number of vehicles, you can't run all the time. Well, these are great. Thank you so much for your input. We're going to have plenty of time at the end of this presentation for additional discussion. I have more questions for you, but they're not going to be done through the Mentimeter polling, so you can close that out. We're done with that. And when we do get to the discussion, we really encourage you to put your comments in the comments box, raise your hand, and we really want that dialogue. This is your opportunity to tell us what we need to be considering as a part of this plan and looking at recommendations to meet your needs. Okay, so I'm going to turn it over to Mr. Baird Bream with Cambridge Systematics. He's going to review the needs assessment analysis that he and his team have been working on, and it's going to cover both some demand analysis as well as some of the survey results we've heard so far. So Baird?
Good afternoon, everyone. Thank you for the introduction, Kirsten. Very happy to be sharing our methodology and preliminary findings with you all today. So to start, the needs assessment that we are conducting is based on a methodology that GDOT conducted for its statewide transit plan in 2019 and 2020. And both of these methodologies are actually taken from a methodology established by the Transit Cooperative Research Program as part of a kind of guidance on how to analyze transit demand, and specifically within rural areas. So we're confident in this methodology. It's pretty robust, pretty reliable. It's been used in a lot of places, and we're happy to roll it out here. Next slide, please. The way the methodology works is through kind of two main categories of demand assessment. The non-program demand assessment shown here in blue, and the mobility gap demand assessment shown here in green. Both the non-program demand assessment and mobility gap demand assessment use demographic information to estimate transit demand based on the behavior associated with certain demographics that are more likely to be transit dependent or transit reliant. So for the non-program demand assessment, these demographics include people 60 and older, people with disabilities, and residents of zero vehicle households, by which we mean people who live in households where they do not have ready access or reliable access to a personal vehicle. And the mobility gap demand assessment takes a similar approach, but focuses on people who live in zero vehicle households in order to look beyond just demographics and actually factor in travel behavior. So they use a calculation of the number of trips taken and the difference in those trips taken between zero vehicle households and one vehicle households. So essentially a comparison in trip behavior between people who lack access to a personal vehicle and people who have that access. And these two methodologies form kind of the upper and lower bound of the demand assessment in order to give us a kind of range of values to work with. Now, you'll see that the numbers here show the kind of current demand assessment for 2019 and the projected demand assessment for 2050. The reason we're using 2019 as a base year is because this demographic information comes from the American Community Survey, which is prepared by the US Census. And because while it's conducted on an annual basis, there are certain data cleaning and data review processes that take place internally, which means there's usually a lag in the release of the data. And so 2019 is the most recent data set that we have available to work with. And we are aligning that with 2019 data taken from the National Transit Database, essentially the data that your agencies report out to the NTD. And based on that, we conduct an estimate of rural transit trip demand and compare that to the existing rural trips in order to understand unmet demand. And what we find is that in 2019, Middle Georgia rural transit providers provided about 59,000 trips. And when we compare that to the rural trip demand, we see a calculation of rural trip demand ranging from 121,000 under the non-program demand assessment, all the way to 407,000 under the mobility gap demand assessment. This means that there's an unmet rural transit trip demand of about 62,000 or all the way up to 348,000. Now, the final line of this table shows the total annual costs, both capital and operating, that would be necessary to meet 100% of that demand and essentially fill the entirety of that unmet trip demand gap. And this ranges from about 2.9 million under the non-program demand all the way to 9.7 million under the mobility gap demand assessment. Now, that may look very large, and that is by design. This is a very kind of maximal approach to estimate what it would take from a funding and finance perspective to meet 100% of all demand throughout the Middle Georgia region and to sustain that service across all the transit providers. So this isn't a recommendation. This is essentially setting, helping us understand the full scope of the demand and the costs associated with that demand in order to inform the recommendation development process. Now, we also project this demand out to 2050 using population estimates prepared by the Georgia Governor's Office of Planning and Budget. They produce annual county level population projections all the way through 2065. And what we see is that projected into 2050, the population of the Middle Georgia region is projected to decline during this time. And so that does impact the amount of transit demand forecasted, and it decreases slightly. For 2050, estimated rural transit demand decreases to about 110,000, and under the mobility gap demand assessment, it decreases to just above 400,000. So it's not a significant decline during this time. There's still a pretty robust transit demand. And that, again, is reflected in the total annual operating and capital costs necessary to meet 100% of that demand, which stays relatively constant around 2.9 million under the non-program demand assessment and increases slightly to 9.9 million under the mobility gap demand assessment. We'll go on to the next slide, but we will be pausing for any questions after we get through this slide. So this slide captures the other type of transit demand that we're analyzing as part of this needs assessment. And it's a little different because while the previous slide focused more on kind of all transit service needs within the counties, this looks at transit service need or demand across counties, essentially recognizing the economic relationships between different counties, where some counties have larger residential populations and other counties are more like major job centers. There's going to be kind of crisscrossing across county lines in order for people to go from where they live to where they work. Now, we are using a proxy estimate of to calculate that transit demand. And specifically, it's an estimate of home-based work trips, which are prepared by the GDOT travel demand model, which is a tool GDOT uses across the state to estimate and model travel behavior and travel patterns. The home-based work trips are used as a proxy estimate because these are essentially work trips, like commute trips, that aren't being delivered or conducted by an alternative transportation mode. So it's a rough representation of what that transit demand could look like. And what we see when we estimate this is, oh, and I'm sorry, the other thing to mention is that you'll notice there's only a few counties listed here. We recognize that all counties likely have some degree of flow back and forth. Again, that residential work gap. But we recognize that not every county has sufficient inter-county travel to justify the expenses that would be required, the capital and operating expenses of actually providing that commuter transit service. And so we use 100,000 trips per year as the sort of threshold value to make that determination that there is sufficient demand to essentially identify a commuter transit market between counties. So what we see is that there is travel both into and out of Bibb County, moving between Bibb County and Houston County, but also Jones to Bibb, Houston to Bibb, and Monroe to Bibb, which again makes sense given Bibb's status as kind of a metropolitan hub for the region. And what we see is that there's pretty robust transit demand across these county flows, ranging from 70,000 trips per year from Monroe to Bibb, all the way up to 460,000 moving from Houston to Bibb. And in all circumstances, this travel demand increases into 2050, in some cases more than doubling, nearly doubling. And most significantly, Monroe to Bibb travel demand crosses that 100,000 trip threshold, where we want to identify it as a viable commuter transit market. So again, even despite the kind of regional population decline that is projected for the Middle Georgia region, we still see pretty robust inter-county travel demand for commuter transit. And so we'll be factoring that into our analyses and recommendations as well. I will pause there and just see if we have any questions on either of these slides. I know we've hit you with a lot of numbers.
Yeah, any questions for clarification or need additional explanation, especially for those that may be calling in that can't see the numbers on the screen? If there's anything you'd like repeated? Okay, all of this makes sense. And I think we just want to reiterate, this is not a recommendation. We're not saying that, Middle Georgia needs to fill this demand 100%. We're just trying to get a sense of what the travel patterns are like, what demand may exist out there today and in the future. And that'll help us identify maybe some projects, some programs, and some policies that can help uh, kind of help minimize that gap. Great. You want to move on to the survey?
Absolutely.
Okay.
All right, now we'll move into our qualitative aspects of our demand, of our needs assessment. These are the provider surveys and the rider surveys that Matt mentioned earlier. Both of these surveys have been issued electronically and are still open through the end of the month. So we welcome you, your colleagues, your constituents to all take these surveys. We've been pleased with the level of response that we've gotten so far. It's been very helpful to hear directly from our stakeholders and get a much more nuanced understanding of what the needs and priorities are for transit, for rural and human services transit within Georgia. So to start, with the provider survey, we've received 36 responses to date. Again, if you've taken the survey already, thank you very much for your participation. And if you haven't, you still have time to do so. From what we've seen, we're hearing a lot of answers that are very consistent with what we understand about rural and human services transportation, but we are seeing some newer challenges that reflect more contemporary issues, most notably the impacts of COVID-19. So fewer than 50% of respondents are able to carry riders to destinations outside of jurisdictional boundaries, and nearly 2/3 of respondents have not pursued coordinated human services transit or regional transit service, which again is definitely something we encounter a lot in the rural transit space, that these are small agencies with small staff. They may not have the administrative capacity to help administer that inter-county travel. Additionally, many agencies have reported less ridership in 2020 than in 2019. Namely, 6 respondents had fewer than 5,000 trips in 2019, but that number now stands at 10 for 2020, which again makes perfect sense with how we understand the impacts of COVID, not just on rural and human services transportation, but on the transit sector as a whole. Obviously, COVID impacted a lot of people's daily lives. It impacted work, with people losing their jobs or working from home, leaving jobs, not being able to travel as they wanted to due to various places closing. And of course, tragically, the loss of life that has taken place may simply mean that there are fewer riders than were historically using transit. But it helps us understand the current state that transit providers are facing, to understand that they are essentially trying to recover some of that lost service, some of that lost ridership, as we think about their needs for the future. And speaking of the future, we asked respondents to indicate what sort of technologies they are either currently using or considering using for their service provision. And the most interesting finding was that while only 2 respondents indicate that they currently use a smartphone app or website for trip planning and fare payment, 8 agencies are considering adopting this tool. which is great to see. It suggests a kind of shift in thinking towards a more tech-centric approach to service provision, which has definitely created a lot of huge benefits for customers. We also asked about state of good repair needs, and the most common response that we heard is purchasing new vehicles, which again, very standard issue, kind of the classic issue for a lot of small and rural transit providers. But interestingly enough, the second highest issue is establishing regular maintenance schedules. And this seems to overlap with some of the larger impacts we've seen on the workforce as a result of COVID-19. What we heard is that a lot of these agencies, a lot of these transit providers share their maintenance workers with other transit agencies in the region, or they share them with other municipal agencies, municipal governments in the county. And as a result, they don't get to schedule their maintenance work when they want to. They schedule it when staff becomes available to them, which influences their ability to get their vehicles fixed up and get them back on the road providing service. So it definitely represents a real risk. And again, we see that as tied to the various workforce impacts that COVID-19 has had. Moving on, we asked for the most significant challenges in 3 areas: administrative challenges, rider demand and satisfaction, and funding. What we heard on administrative challenges were, again, a mix of the traditional responses and the more contemporary issues. The first being compliance with state and federal reporting, which again, we encounter a lot in the rural transit space due to the small agencies that operate and administer that service. It's a big responsibility that needs to be completed by a small staff. The other issue was attracting and retaining qualified personnel across all areas, really. Most significantly, or perhaps best illustrating this, we heard in an earlier workshop from a transit provider representative who said that a lot of their drivers have actually left transit operations to go work at fast food restaurants, because the fast food restaurants are, fighting for workers as well, and are able to pay a lot higher. So it really speaks to the extremely competitive environment that we're experiencing for qualified personnel. Among rider demand and satisfaction, we hear that agencies struggle to expand service into new markets and make sure that transit is going to where people want to take it. But they're also dealing with the public perception of transit, which again we see as a factor of COVID-19's impacts, where people started to worry about their personal safety in enclosed spaces where they're close to people, can't necessarily maintain social distancing. So we're trying to be cognizant of those challenges as we think about our recommendations, recognizing, that transit agencies may be struggling to essentially market themselves differently, or make a case for themselves to a concerned community. On the funding challenges, we heard, again, a very kind of standard traditional response that the greatest challenge was securing local capital funding. Again, small agencies are often working in small areas with county governments that are, limited in their funds, are running pretty lean operations, and finding the money for those longer term investments can really be a challenge. But we're really pleased with the responses we've heard on these provider surveys. But again, they are still open. We welcome your participation if you haven't done so already. We will move on to the rider survey, where we have received 55 responses to date. Again, we're pleased by this level of response. What we've seen, interestingly enough, is that 85% of the respondents do not currently ride transit. Obviously, we're happy to know that people who don't ride transit are still motivated to take this survey, because understanding how transit may not be meeting their needs can be really valuable to help us understand how to improve this quality of service. Of course, we would like to hear from more riders, because obviously we don't just want to chase after people who aren't riding transit, who may be reluctant to ride transit. We want to make sure that we're also meeting the needs of our current riders who have found value in it. So among those who ride transit, their main
Hey,
reason
Bear.
for, oh, yes.
I don't want to interrupt you really quickly, but there is a comment that's kind of speaks to what you're talking about
Oh,
from
please.
Lindsay. She's saying what are some things that are being done to further protect employees from things like COVID-19, specifically the drivers?
That's an excellent question. I mean, we'd love to hear from transit providers on that because we do recognize that some of this some of these decisions will be made specifically at the agency level. But I do see Matt turning his camera back on, so I think he may have something to say on this topic as well.
And that is a great topic and a great way to ensure that we keep everybody on the vehicle safe, not just the passengers, but the driver as well, the operator. I know that GDOT does sponsor additional funds for COVID-19 safety equipment, which includes shields and other sort of cleaning equipment. We can talk offline about those options, specifically with, I think Carrie Anderson is on the phone. She's the project manager specifically assigned to this region for GDOT that manages these types of projects. So we can talk definitely about those and their options.
Any other additional questions on driver safety or COVID-19 response procedures? Okay, sounds good.
Yeah, I think that's good. She says she's good, so I think we can move forward. Thank you so much, Bear, and to you too, Matt.
Thank you both. So returning to the rider survey, among those who do ride transit, the main reason for using transit is that they lack access to a vehicle, and their most common trip purposes are for work, medical appointments, and dialysis appointments. So what we see is, you know, a wide range of service of needs being met, including some that are extremely time sensitive and really important to the overall quality of life of these users, because obviously, you know, failure to reach something as critical as dialysis can leave people exposed to significantly greater health risks and frankly just put them in a lot of pain. We did hear that if transit were not available and riders had to find an alternative, the most common response is that they would get a ride from a friend or family member. That's very common in rural and human services transportation, that people rely on their social networks. However, we know that that's not a pain-free process. That can be complicated, that can be inconsistent. It can create a burden for that friend or family member who's providing the trip. And so we want to ensure that transit is there as, you know, a steady and reliable option for people that frankly gives them a little bit more independence as well. Among those who don't ride transit, their two most common reasons for not doing so are that they are interested, but transit is not convenient, or that they are not interested, which again speaks to perhaps that public perception issue, that COVID-related issue of what transit agencies are trying to do when they present themselves, when they market themselves to the community, to overcome that disinterest or that perception that transit can't meet everyone's needs. The most frequently selected challenges for using rural and human services transportation is that transit does not go where they want to go, the distance to the nearest transit service is too far, and that it's not reliable enough to use for time-sensitive trips, again, like healthcare appointments or dialysis appointments. So we're getting a lot of, you know, kind of classic issues of rural and human services transportation in these responses regarding, you know, service coverage, determining what sort of trips or what sort of trip locations are eligible under the service area, and in making sure that that first mile, last mile connection to where people are starting their trip is still well met. When we asked respondents to indicate which sorts of transit improvements they want to see prioritized, what we heard was ensuring that access to jobs and access to healthcare are both maintained, and that different parts of the community or region are connected together. So again, overlapping with that issue about transit not going to where they want to go, we see the need to expand transit coverage area in order to meet everyone's needs. We also asked the riders, or the survey respondents rather, to indicate which sorts of transit technologies they want to see prioritized. And what we heard was a demand for more real-time information, both at transit stops, but also real-time information being available via smartphone, website, or text. So again, it speaks to that need to have transit be reliable, to have transit be consistent, so that for some of those time-sensitive stops or destinations, the rider has as much information as possible to know how to plan their trip and can put faith in that information that the scheduled time will be the arrival time. And that concludes our overview of the survey findings. Again, if you've taken it, we thank you for your participation. We encourage you to continue sharing the survey with your communities, with your constituents, and your colleagues.
All right, thanks, Baird. So we're going to transition to our discussion, and we'll use the remaining time to answer questions that you have, take your comments. Again, if you are joining us by the Teams link, you're welcome to raise your hand if you would like to speak. Alternatively, you can use the chat box. If you are on the phone, you cannot raise your hand or use the chat box. So we invite you to unmute your phones now. And if you would like to chime in with comments or questions, please do so. So we've talked a lot about the needs. Baird presented what we heard from the survey as far as needs from a provider perspective and a rider perspective, as well as some of the gaps that we're seeing based on demographics and other travel patterns. But what else are we missing? What other needs do you have? Are there specific connections that are missing? I think, one of the constraints was not being able to cross jurisdictional boundaries. So are there specific connections that you feel you need to be making from your region, perhaps to other regions or other areas within this region? Any other service gaps?
So Lindsay says, is there some sort of option where there can be text reminders sent to frequent riders? Like, for example, if there is a holiday or COVID exposure and they need to close down for the day, so that individuals can, in fact, make alternative options to get where they need to go. Thank you, Lindsay. That's a great question.
Yeah, Lindsay, I think that's a great suggestion. I do think that there are systems out there that exist that can achieve that goal of providing information about service interruptions, service outages, closures. Maybe it's a closure due to, COVID or a weather event. So I do believe that those are out there and that I've written that down. These are the types of things that we want to hear about, because what we're going to do is go back and do some research and see what's been done in other parts of the country, other parts of the state, maybe even internationally, to see what's out there and available that can address some of the issues that you're having. So thank you, Lindsay. I appreciate that.
She said that's what she was hoping for.
Okay. Yeah, it's those, and I mean, that is one of those programs that we want to look into, a messaging program to keep your riders informed with real-time information. We heard that from the survey, that's what they want. They want more real-time information by text or website or smartphone apps. So I'm going to kind of switch gears to another big topic when we talk about rural and human services transportation, and that's the coordination piece. So there are a few regions across the state that have really tried to implement region-wide coordinated systems. We talked to Coastal Region Commission this morning. We're going to be talking to Southern Georgia next week. We talked to Three Rivers yesterday. So we really want to understand from you if this is something that you're still looking at and considering, I know there have been discussions in Middle Georgia about creating a regional coordinated system. But I'm curious to hear from you. What are the discussions today? If you're not interested in a coordinated system, what are some of the challenges or barriers from moving forward with a coordinated system? Perhaps it's political, perhaps it's counties not wanting to put up the local match because of funding constraints. Um, so really just kind of want to get you thinking about coordination and you tell us what's going on in the region. Is there some coordination between the rural public transit or even the urban transit and some of the human services transportation? Are y'all coordinating somewhat in this region? And again, there's going to be plenty of time for y'all to provide comments and ask your questions. We'll have our contact information up on the screen at the end of the presentation, both Matt and my contact info. You can email or call us with any of your questions or comments. We'll be taking those until March 4th. A recording of this presentation will be made available on the GDOT website. We'll have that link for you, and we'll tell you about that in a few minutes. But this is really your chance. So we really encourage you, if you've got any thoughts, we definitely want to hear them.
And we also have at least four people on the phone too. So we want to remind you that if you're on the phone and if you want to, of course, leave a comment or have a question, feel free to unmute yourselves and we'll be happy to take your questions or comments.
Yes, thanks, Jacoda.
Sure. Lacey, Lindsay, calling a couple of names just in case you have anything that you want to comment on. I don't want to, pick on anybody, but we definitely really want to hear from you if you have anything to say. Well, let's see. Okay. So, of course, if you can't think of anything right now, we'll take your questions later, but this would be the perfect and opportune time because you got everybody who needs to answer those questions or who can take your feedback who are available right now. So
yeah, I brought up another slide. So
okay, I'm sorry. I'm sorry, Kristen. One comment is that we have a lot of elders in our area where technology is not as easy. We've heard this before. So we need to find a way to help them, but also keep it organized.
Yes, I think that's a great suggestion. And it's a challenge, right? Everything seems to be moving in kind of the technology, smartphone app, book your trip, pay for your trip, all on this app, and it's leaving out a very, very large demographic, a demographic that keeps getting larger. I mean, the baby boomer generation is the generation that we're talking about, and a lot of them are getting older. My parents included. Lord knows how many times I've had to tell my mom how to turn the speakerphone on her cell phone, right? So it is challenging, and they want the more traditional. I want to call in and book my trip in person. I don't want to email you or text you or get a text. So how can we do that? Balance the technology and stay organized. Great suggestion. I've got a couple other general questions up here just to kind of get the brainstorming going. But are you finding that the cost to the rider is preventing your system from having a higher ridership? Is it becoming too cost prohibitive because of constraints that you have on other areas? Maybe you are having to pay your drivers more, and therefore you're having to raise your fares. And this is specific to public transit.
Really quickly too, Kirsten, Lindsay says she's seen other services send out automated calls that are pre-recorded. Just a suggestion. And we have no problem with you commenting, Lindsay. Don't feel like you're interrupting. We appreciate every bit of information that you're providing. Keep it coming.
Yeah. So are costs getting high? Are you experience operating and administrative needs? Are you guys feeling the labor shortages that other systems are? Are you experiencing your drivers leaving? Or maybe you don't have the mechanics available, or maybe, with the supply chain issues, are you guys ordering vehicles and finding that they're getting delayed by months, maybe years? We heard that from Coastal this morning that their vehicles have been delayed by a year.
Wow.
Yeah. That puts a major constraint on the existing vehicles that they have, because it's I think most providers, you're ordering vehicles anticipating when your existing vehicles are going to reach their serviceable life. And then when that gets delayed and you're having to rely on these existing vehicles that sometimes have 400, 500,000 miles on them, you're constantly having to get things repaired and maintained. Your maintenance costs are going up. Your service availability, your vehicles are not in service, and so you can't provide all the trips you need to. It has a ripple effect. So I'm just curious if you guys are kind of feeling these pains too.
Lacey, did you want to have a comment? And while we're waiting on whether or not you want to say something, we also have a comment saying in a smaller area, we tend to have fewer employees, and I think anyone would like to get paid more. Lacey is saying people that I talk to in Bibb County say it takes a giant amount of time to get anywhere because so many buses have to go back to the station.
Okay. It's good to know. These are great comments, and this is exactly what we want to hear. So I kind of have one final question, and it can be as crazy or far-fetched. Okay, I think we have another comment.
It's I feel like if there were more stopping points, that might help, but I'm
Okay.
not 100% sure on how that works.
Okay. Are we talking specifically about the make and bib system with stops? We're not talking about demand response. I would assume that's where we're talking about. Wilkinson. Okay.
Wilkinson.
Okay. Good to know. So one kind of far-reaching question. Let's just hypothetically, if someone were to drop $1 million in your lap and they said you can spend it however you want, how would you spend that money? I hear typing.
Somebody's typing. Lacey says more buses and more routes.
Service expansion, more vehicles, more drivers, more routes. Takes a lot of money. Okay, great. Who else? Let's see. Upkeep.
Another one says probably the upkeep. This is Lindsay. Probably the upkeep and maintaining of vehicles. I would also even maybe do wrapping of the vehicles to advertise the services with bright and vivid colors.
Yeah, I think I think that's been a strategy to kind of address that perception issue. You know, a lot of times people don't want to get on public transportation because, let's be honest, sometimes the vehicles are looking a little old and a little run down because they got a lot of miles on them. So I think we've seen that in other areas of kind of this rebranding and making the vehicles look bright and fresh and, more modern. make people, kind of change that perception about what transit really is. So I think that's great. Okay, well, again, oh wait, we have another comment. A couple comments. Let's see, we've got Lacey. When I lived in Seattle, a bigger city than Macon for sure, each stop had times listed for the buses along that route. This eliminated the need for technology by all riders. I agree. Having that route information available, even if it's static, is a step in the right direction.
And then it also says, I think that what happens sometimes is that we kind of push the vehicles to their limits, like get right up on the threshold of what the max miles that they can take in order to save money.
Yeah, and you're not alone. Like I said, I have seen vehicles with 500,000 miles on them. Not uncommon. So it sounds like new vehicles, a better plan for vehicle replacement, or at least the funding in place for vehicle replacement. And I like the idea about the bus routes having that static information. I think what we heard from the riders, or what I've seen, in larger transit areas, is that at the bus stops, they actually have real-time digital signage that let you know if there's any delay in that schedule, so that people can make decisions on the fly if they stay there and wait for that bus, or if they need to find a different solution.
Lindsay says she likes that idea.
Yeah. Okay. Excellent. So Matt, I'm going to turn it back over to you to wrap up the last few slides.
Awesome. Thank you so much. I just wanted to double check on the question from Lindsay. She said is that electronic? And you're talking about the digital message sign about the time for buses on the route?
Yes.
Yes, that'd be electronic.
It could be powered. It could be solar powered if you have, obviously enough sunlight. So there's different power sources that can be used to power up those electronic signage.
Yes, but providing more rider information is definitely a key strategy. I think what more riders want when they ride public transit to have reliable service. They know when it's coming and when they're going to get there. The reliability component is huge.
She says those would get destroyed on a regular basis, though.
I've seen them up in Boston. They can survive pretty well. I've seen it. Didn't take a punch or two, but that's a good point about making sure that they can withstand everything. But just real quick to review our schedule one more time, we are working on the existing conditions assessment and the alternative analysis now, and we'll start the development of the draft final report in the coming months. Again, we're targeting July for publishing the draft final report on our website for that public comment. Once again, I want to thank you all so much for your participation today, your active participation today. It was really helpful, all the comments we heard. Please do not hesitate to reach out to Kirsten or myself with any questions or comments on the information we shared. Also, we ask to please take our survey, whether you're a provider of RHST services or a writer. We want to hear from you. For those on the phone, you can find the surveys at www.dot.ga.gov/transit. And my email is mawilson@dot.ga.gov. And we ask to send any comments or questions by March 4th, so we have time to respond. There was one comment I just saw come in.
The comment was, I wonder when we have those bad thunderstorms and rain, would it hold up?
I hope so.
Well, and I think to that point, I think when we are thinking about the bus stops that exist today, they lack the general necessities of a bus stop. I don't want to refer to them as amenities, because I don't think that they should be referred to as an amenity. I think they're a necessity, and I think bus shelters are one of those. So I think in addition to providing the real-time information, there needs to be protected.
Lindsay also says, do most locations have benches, things like that? And then Lacey says they're lean-tos and it's not great.
Yep. Yeah. I can't speak for every system across the state of Georgia as far as having benches. I know, where I live, it's sparse at best. It's usually just a pole stuck in the ground. And I think riders are lucky if they have a sidewalk that accesses that said pole or bus stop. So I think there's a lot that can be done on the infrastructure for people waiting to protect themselves from the elements like those horrible thunderstorms we can get, as well as any signage or electronic signage.
She
Yes.
goes on to say it would encourage riders if there was a shelter type of place with a bench for sure. And then Lindsay says for funding for those types of things, couldn't we have local business advertise in a way to fund those?
Yes, you can. MARTA does it in Atlanta. And they have a third party company that does all of the installation, does all of the contracts with the businesses for the advertising, collects the revenue. So yes, there are models out there, and we'll be sure to include that in this analysis. Any other questions or comments before we say our goodbyes for now? I think we have something else from Lindsay. Yeah.
She said she just wouldn't want a 64-year-old grandmother sitting in the rain with no cover.
Yeah, agreed.
Mhm.
I don't want anybody sitting out there, but especially our aging populations.
Awesome. Well, thank
This has
you
been
everybody
fantastic.
again. Yep.
Yeah.
I'll let Christian just close us out real quick.
All right. Well, thank you, everybody. Have a great afternoon, and keep those comments coming.